Sujana Chandrasekhar and General Surgeon Dr. Marina Kurian. They'll be joined by guest experts to discuss an array of newsworthy medical and health issues. You're invited to ask the doctors anything. The physicians and their guests' views are their own and do not represent any institution. Please contact your doctor for any personal questions. Please hit share and join us live on Facebook, Twitter, and YouTube at She's On Call, #She's On Call. Please welcome our hosts.
Hello, I'm Dr. Sujana Chandrasekhar. I'm an ENT surgeon and I practice in New York and New Jersey.
Hi, I'm Marina Kurian. I'm a general surgeon and a minimally invasive surgeon that does medical and surgical weight loss here in New York City.
Welcome to our show, She's On Call. This is our 7th episode, and Marina, I think it's going pretty well.
Lucky 7. This is a big show today because, we're going to be talking about some really important topics. And you guys who watch us weekly, first of all, we thank you for being loyal to us and coming and sharing your Sundays with us. But this week, we normally do like a big synopsis of the topics in the news. But this week, we're just going to do one because we really think that getting back to discussing return of our children to schools is so important.
So, we started this show because we're always on call. We're on call for our patients and our communities and our families. And this week, I had another She's On Call aha moment where a neighbor posted on the local Facebook page about her husband who had a medical issue and was advocating for him. So I think She's On Call applies to many, many of us, whether we're in medicine or not. But let's start talking about the news that Marina alluded to. So something really interesting went around like wildfire in the medical community this weekend. There were suddenly pictures of physicians in bikinis appearing all over social media, which is a little weird. So why do you think? Well, a paper was published in the Journal of Vascular Surgeons that was called The Prevalence of Unprofessional Social Media Content Among Young Vascular Surgeons. And what they did was they set up the authors set up fake social media accounts. They found the accounts of young surgeons and concluded that half of the 480 surgeons had social media accounts, and a quarter of those people had what the authors defined as either clearly unprofessional, which was, of course, drug use and violations of patient privacy, or potentially unprofessional content.
And this was really an issue because so many levels. First, it really spoke to a lot of bias that was inherent to the people who were reviewing the social media accounts themselves. It also really was a violation of privacy, and also missed the point that many physicians have a right. All physicians, not many, all physicians have a right to enjoy their personal life. So some of the problems that they pointed out were that there were inappropriate posing in either bikinis, or they were shirtless, or that people had a drink in their hand when they were in a picture. Suju, I don't know about you, but I have had, I occasionally have a glass of something, and sometimes people take photos. That should not constitute something that is unreasonable or unprofessional by any means. Especially, American Heart Association says it's okay to have at least one glass of red wine a day, right? So this was wrong on many levels. The methodology was flawed, and the article has now since been retracted, and the authors have all apologized, and the Journal of Vascular Surgery has retracted the article. But it came up and showed what advocacy is really about. There were so many he for she that thought this was so inappropriate that, shaming people for being in bathing suits or bikinis is just ridiculous. And so that's what that last picture you saw up there with all the ladies in bikinis, like this was, #medkini. I mean, it became so strong. Actually, one of my friends told me that Instagram took down the hashtag because they were being overwhelmed.
I think this goes to implicit bias. We talked about this with Dr. Quinn Capers a couple of shows ago. And I think when you have an editorial board that looks very uniform and has very uniform experiences, you really fail to see the problem. This article got through what we call peer review, which is usually a very rigorous process. I mean, I would have been criticized had I been seen for not only having pictures that show me as a human, but in fact having opinions like wear a mask. These are really important points. And I'm glad, Marina, that you wanted to bring this up. But I think we should get to our guests now.
We totally should. So our show today, we do have a total of 3 guests. We're going to start off with 2. Dr. Sarah Goza is joining us. She is the current president of the American Academy of Pediatrics. So welcome. Thank you so much for joining us in our discussion today about when to reopen schools. Is it safe? There's been so many questions that our viewers have already pre-asked. So thank you so much for joining us.
Thanks for having me.
And our guest who will stay with us for the full hour is Dr. Heather Klaus. She is a professor of infectious disease at Temple University and dean of faculty there. Heather has been, as you said, eating, living, breathing COVID-19 for the past 4 or 5 months. And I think bringing science and bringing thoughtfulness to this discussion is really what this show is about. So welcome aboard, Heather.
Thanks for the invitation.
So maybe we should just start off with one of the questions that we've had, because, actually, Sarah, the American Academy of Pediatrics has signed on with some of the recommendations from the CDC. So I think we have a card for that, but we would love to hear your thoughts first to start off.
So the American Academy of Pediatrics came out with guidance about school reopening. This came about because a lot of pediatricians were getting questions from parents about what should we do about school. And our basic principle is that children need school, and that we do feel like children need to be in in-person school, but it has to be done safely. It needs to be safe for students. It needs to be safe for teachers and for staff. And that's really going to depend on what's going on in your community with the spread of COVID-19. And so public health is going to have to be intimately involved in when it's going to be safe to open those buildings. And the teachers and the school administrators are going to have to figure out how to do it safely. And we did have a 9-page guidance about some things we thought they could do to make it safer. And a lot of those did align with what the CDC had as well.
So we really appreciated that. I think the fact that all of this data is being made public and in language that people can understand is really very helpful as parents and teachers and counselors and Board of Ed professionals try to navigate these waters. We are far from being done with COVID-19. The cases and the deaths are still rising in most of the country. Now New York, New Jersey, and Connecticut have banned 31 people from 31 states for coming here without staying quarantined for 2 weeks. And I wonder, we know that testing, tracing, isolation is the way to go to dampen the incidence of this problem in the community. So I wonder, Heather, if you could talk to that as a community issue, and then we can pull it back and say, what should we do in the schools?
Sure. I think for the communities, the most important points are the things you mentioned, maintaining social distancing and not gathering in large groups. Also, the wearing of masks is critical, really, regardless of whatever circumstance you're in. And I think that the community's ability to trace and follow up on exposures to COVID-19, I think are really what is allowing and going to facilitate schools opening, because schools are really a microcosm of their communities, and what's going on in the community with regard to the COVID-19 pandemic is going to be going on in the schools.
So, there's some really great articles coming out. There was an article written by the former director of the CDC and 2 former education directors talking about these sort of 8 steps to reopening the schools. And it was really very detailed about having, as you see, shielding the most vulnerable students and teachers, reducing the risk, as we talked about, with masking and social distancing, keeping the virus out of the schools so random people can't come visit, Don't mix groups, so don't have kids change student and staff group. Reducing occupancy, maybe teaching outdoors if possible, thorough health and safety protocols, and preparing, unfortunately, for inevitable cases. And I wonder, Dr. Goza, Sally, if you can talk to what the American Academy of Pediatrics in its guidance is telling people about these topics.
We actually touch, I think, on all of those 8 points, in that, if we're going to have children back in school, we need to be sure they can do the cleaning and the disinfecting as the CDC recommends. We need to have the classes be able to do some physical distancing. And we actually did talk about, think about doing a lot of things outdoors, if at all possible, to try to keep the children from being in school. And also distancing for the teachers, because we know that adults spread it actually more commonly than children do, or at least the younger children. And so having the teachers not go into the break rooms or into the office and congregating, and having them keep their distance as well. And then mask wearing. I saw something on Twitter today that talked about wearing is caring. And I love that about wearing masks, because that's very true, that wearing a mask is caring about other people. And we really need to make sure and do that. And then the mask wearing of the children, really trying to teach these children that they can wear masks too. It's safe to do that. And a lot of children are really good at it. I'm always amazed at the children who come into my office, and I love it. I tell them, you're rocking those masks, because they keep them on sometimes better than their parents do.
Yeah, so this is a slide from the CDC. Guys can actually go to the CDC site to see this, because it's a little bit busy, but it kind of tells you what schools in each community should be looking at before they start opening. Many schools are going to actually open like next week, I think, because they have an early August opening. And I know that some of the colleges are going to open as well. But it's important, I think, first of all, I know both my kids' colleges are looking very closely at the CDC recommendations, and also how they're going to make changes at their universities to accommodate students, and to do like probably a partial remote versus on-site learning program for all of the kids. So it's so important. Do you see that, Sarah or Heather, there have been so many questions that have been asked, and one is that if someone at the school tests positive, then what will be the protocol? And that's something that we all are kind of concerned about. We're all in the hospitals, so or in our offices, so we know what we do to protect ourselves. But it's going to be interesting to see what happens. And now the CDC also dropped the quarantine time to 10 days, but still, if you're going back to school and then you get an exposure, it's going to affect a lot of things.
Heather, your microphone is muted.
Okay, she's back.
Okay. I think the most important thing is to have a plan ahead of time of what you're going to do when there's going to be a case in schools. And I say when, not if, intentionally. I think that the key is going to be removal of the child from the school as soon as possible, and then being able to trace all the contacts that they had greater than 15 minutes within 6 feet of that child for the preceding 2 days before they became symptomatic. And so that's the basis of contact tracing. And then those individuals need to also monitor for symptoms and really take care to not spread any contact any further.
What I like that you said that we don't hear very often is that it's if you're with someone for more than 15 minutes. Right. So time, we also had another question about allergen load, how long you're with the virus, and how much of the virus you reduce. There's some talk that really determines the severity of the COVID or the corona disease that you're getting, the COVID-19 disease. So that is a really important point. Quarantine first, and then what's the plan for testing? So there's 2 types of testing. You can talk about PCR testing and antibody testing. And then also, just because you're exposed doesn't mean you get tested right away, right? You're supposed to wait a few days, because if you test right away, you might come back as a very, very much false negative.
Right. So the two types of testing are PCR testing, which often involves either nasopharyngeal swabbing, nasal swabbing, or throat swab. And this tests for actually active viral RNA in you at the time. And as you pointed out, just because you're exposed doesn't mean that you should run out the next day and get a test. Ideally, you would wait 7 days from exposure because that's the median amount of time that it takes to develop any sort of symptoms or enough particles to even find with those tests. So again, the PCR test is really a snapshot in time. And just because you're negative on one day doesn't mean that you're going to be negative for the next week. So it's really important that you know that a PCR test represents a snapshot in time. The antibody test, on the other hand, is a blood test, and you can do that through a traditional blood draw or a finger stick. And that really represents whether you've been exposed to the virus and whether your body has mounted any sort of immune response to that exposure. It's been shown that the antibodies last approximately 2 to 3 months, and that has implications for vaccines that I'm sure we'll talk about later.
So the pictures that we showed while you were talking, Heather, showed how deep that nasopharyngeal swab does go. One of Hari Kondabolu, who's a comedian, said, "I went for a test and they biopsied my brain," because it really goes quite far back. The antibody test is very simple. That was my finger, unmanicured and unlotioned, doing the antibody test, which I'm negative. But I think that these are testing, and I think limitations of tests that parents and educators really need to know about. One of our viewers, Kuna Marora, asked, in your opinion, are kids with well-controlled mild asthma low, medium, or high risk because of their underlying condition, and how should the parent weigh that risk before deciding to send them or not to school? And maybe I'll ask Sally to answer that.
You know, we do know that children that have asthma may be at a little bit of an increased risk, but really at the lower medium level, it's probably not as great of a risk as you would think. I think if you're at high risk, that's something you would want to talk to your pulmonologist about, as to how well you're controlled and all of those things. I think if parents have any question about their children and what their risk factors are to going back to school, especially those with chronic health conditions like asthma, they should call their pediatrician and ask them, because those pediatricians know those children, they know how sick they can become, and they know their history. And so I encourage anybody that has a child with special needs, or any parent who's concerned about whether to go back to school or not, to call their pediatrician and have a discussion.
I think also, Sarah and Heather, both of you would agree that a lot of it depends on what's happening in your community as the kids are going to school, and the level of disease that's present in the community before you can say, okay, it's totally safe or not. I mean, I am actually totally okay with my kids going away to college. I feel like they're going to do the appropriate things, and the colleges are being very careful and have a plan and strategy in place to help protect their community. So I've been okay with it, but I think, you know, it really depends on what is going on around and practicing. I'm a huge fan of the mask wearing. Some people say, oh, you know, it doesn't work. I think it's protective. It may not be completely preventative, but protective is good. I like that. We can settle for protective and still think it's a fantastic option. And I think that will help get us back into schools. Because we also had another question when they're talking about, and someone texted, it's hot in Texas, and you know, you have the kids out and it's fine, they're wearing masks in their classroom, but then they go out to recess and it's super hot. You know, are they supposed to be wearing the masks out there, and what will happen? Because younger kids may not socially distance as well as older kids do. What do you guys think about that?
I think that it's been pretty well established that there's less spread outdoors than indoors, and this is the reason for the restrictions that different communities have put on things like indoor dining versus outdoor dining as we open back up the economy and things. And I think the same is true for children. Outside at recess, if they're more than 6 feet apart, the masks may be a little bit less important than they are when they're in the classroom, potentially not as socially distanced because of given limitations of space in classrooms and in schools. So I do think that the point is well taken about the heat in Texas and really a lot of the United States in the summer, but masks are critical as much as we can enforce them, and really the outdoor exposure and the outdoor space is a much safer one.
So I wonder, Sally, first of all, you're in Fayetteville, Georgia, so it's kind of hot down there, I would say, because it's boiling up here. I wonder if you can address that and whether there is concern about, even in an outdoor classroom, the teacher kind of talking over the din, whether of the traffic or the kids. Should the teacher be wearing a mask to protect projecting or aerosolizing particles? And then I was hoping you would address the very rare but very horrible disorder, MIS-C.
Thank you for that. So, we believe that the teachers should wear masks. We know that adults are more likely to spread it, and to be at higher risk if they do get the disease themselves. So we are recommending that teachers do wear masks. And so even outside, I would recommend that the teacher wear the mask unless she's a good 6 feet away from everybody, which can be hard to project too if you're 6 feet away from the whole classroom. So that's really in our guidance, that we feel like teachers need to do whatever they can to protect themselves, and one of those things is to wear masks. MIS-C, we're learning more and more about it as we go along. We have researchers and scientists looking at it. The NIH is looking at it. It's a very rare disease still. We do know that it usually happens several weeks after the surges of COVID-19 in communities. But one of the most important, the things that's worrying us the most is the disparities in it, that 71% of children that had MIS-C were Hispanic or Black, as you're showing on that slide there. And so that's really concerning to us, as to why is there such a disparity in this? And we tell parents to watch for the symptoms of this. If your child has persistent fever, is not acting right, is seeming really, really sick, you need to call your pediatrician to find out what you need to do. And especially if you know they've had COVID-19 or they've been around someone who did, because the majority of these patients have either had COVID-19 that they may not have known they even had, or they've been exposed. And so it's very important that if we have really sick children, they need to be evaluated. Away from the whole class.
Yeah, that is so critical, I think, and it is so kind of weird. Heather, do you have any thoughts about, is it a proximity thing? Is it densely packed or closer living conditions? Like why would we see it so much more in Hispanic and African-American children?
I think early on we found this in the adult population as well. And I think that there's not a genetic predisposition that would make this true. It's related to social determinants of health and the things that disproportionately affect the Black and Brown communities, such as living situation and food insecurity and close-knit communities. I know there's been instances of several family members at a time being hospitalized with COVID-19 and multi-generational households and things like that that may disproportionately be present in those communities. And I think that explains, at least from the adult side. I can't necessarily speak to the pediatric side, but that explains the adult side of why we saw an increased incidence of both hospitalizations and disease in the Black and Hispanic Latinx communities.
So Nina Maginot, who's one of our viewers, is asking, have those children been immunized? So are we seeing worse disease in children who may not have had their normal immunizations, maybe because everything was delayed because of COVID?
I don't think we have that data to be able to say that, to make any conclusions about that. I'm sure that's something that will be looked at, but I don't believe that data has been gathered on these children. And if it has, I don't know it.
Right. Thankfully, this is occurring in a very small percentage of children that contract COVID. So I thought one number was 1.5% or so. It might even be less, and you guys can certainly speak to that. But if we look at that group of kids that have gotten it, and as we know, kids aren't getting it as much as adults, and then to add to that, it's 1.5% or less. I might have the number off. And then to create like a pool of data that we can actually make any kind of statistical or real clinical analysis of, means that we would need hundreds of thousands, and we just don't thankfully, we don't have that many in children. And Heather, I love the point that you made about the social determinants of pre-existing conditions, because Latin America is seeing a huge surge in COVID-19, and yet they're not seeing any greater numbers of MIS-C there, considering that we're seeing a lot in the Hispanic and Black communities.
So, there's a question from J.H. Kim about temperature checks, and the concept being that before entering school, before entering college, community college, or four-year college, and certainly before entering my office, we're checking temperatures on people. Heather, can you talk a bit about, is that effective? Is it like taking our shoes off when we go on an airplane? Like, what should the screening tools be that try to keep us as safe as possible?
I think even more effective than the temperature checks is self-monitoring for symptoms, taking your temperature once or twice a day, assessing whether you have any twinge of a sore throat or a headache or fever. The temperature checks, I think, are helpful for anxiety levels and are helpful, but I don't think materially, especially given the changes in weather and especially the heat of the summer, that they're necessarily reliable and reflect a person's actual body temperature, at least when done with the infrared scanning thermometers. I don't mean to be a naysayer, but I think that there's definitely other things that are more effective to prevent people who may be beginning to be symptomatic with COVID-19 from entering a given workplace, building, or school, such as monitoring for symptoms and taking temperatures at home with an oral thermometer.
You guys who are watching, this is a great conversation because we have such wonderful guests, and this is going to go on till 12 o'clock. That's our show, 11 to 12. So those of you who are watching, if you have friends that might be interested, please do tag them and let them know that the show is going on right now.
And unfortunately, we are going on till 12, but Dr. Goza does have to leave at 11:30. So I'm hoping, Sally, I know, you're a fierce advocate for healthcare for all children. You're a fierce advocate for what I think is common sense, science-based treatment of children. Maybe you can leave our viewers with maybe 3 takeaways that you'd really like them to remember from this.
Thank you. I really would. So number one, we all know that children need school. And so we as a society have to figure out how to make school be able to be reopened safely for the teachers, for the students, and for the staff. And so to do that, we need to decrease community spread. So just like you were saying, wearing a mask is caring. That's going to help get our community spread down. We need funding to help make sure we can get the schools open safely. And we need our children back into that schooling so that they can get everything they need, because it's more than reading, writing, and arithmetic. But we have to do it safely, and that's the key to that. And I appreciate y'all having me for this segment.
No, thank you so much for joining us. And I think those are excellent points. And the funding is important. We have to support the children going back to school, and the teachers, the faculty, everyone at the school. When we talk, as you know, in healthcare, we talk about the hospitals opening and they're taking care of all these COVID patients, and the nurses and the doctors got all the shout outs. Well, the people who greet the patients at the front door, our unit clerks, the people that clean, the hospital, everybody needs, they're all considered essential workers, but they all need a shout out. And certainly at the schools, it's not just the teachers, it's the staff that are working in the building and also trying to keep the area very clean for the kids, also very important. So again, Sarah, thank you so much again. Dr. Sarah Goza is the president of the American Academy of Pediatrics. Thank you so much for joining us for this half hour. And it's now our pleasure to welcome Donna Mazyck, who is, as she is so proud.
Oh, we lost Marina. So thank you very much, Sally. And we're very proud to bring on Donna Mazyck, who is a registered nurse and the executive director of the National Association of School Nurses and the past president of that same organization. She has served her community for 25 years. prior to assuming this executive director position, and we're really happy to have you on board. And I thank you for listening for the first half hour. Can you give us maybe an idea of what you'd like to bring to this discussion?
Hello, it's good to be here with you all. I want to remind folks that public schools serve all students, and health is linked with learning. And school health service is a student equity issue. And so we believe that school nurses and their ability to care for the entire student population, especially the most vulnerable, by identifying students at risk and helping them get the care needed. Those school nurses are tracking and addressing health concerns and decreasing communicable disease outbreaks in multiple ways. And school nurses are needed because they have the expertise in public health and infection control practices.
I think that there's so much that we rely on our schools for. And I think getting children back into school, having the interactions. I mean, I think all of us went to school, and you know, what a wonderful and magical time. I wonder, Heather, if you can talk to our audience about vaccines, because I think Sally saying mask wearing is caring was beautiful, and people are sort of loath to accept that something as simple as wearing a mask and keeping your distance and washing your hands will help. And they're kind of pinning all their hopes on the elusive vaccine. So I wonder if you can talk to our viewers about where we are in vaccine development and how realistic the timeframes are.
Sure. I mean, I can't underscore enough how important the mask wearing and the hand hygiene and the distancing is. Vaccines are a little ways away, as best as we know them. There are about 25 or so vaccines in clinical testing right now, some in phase 1 and phase 2, and only a handful in phase 3. And the soonest we would expect a vaccine would be in 2021. And the platforms are different, and the testing is different. And recently there's been publication of some interim or initial results from 2 companies that are producing vaccines for COVID-19. And both showed that there were successful immunogenicity, meaning development of antibodies to the COVID-19 virus. And also that there were most importantly, that there were no serious adverse events with those vaccines. And I think that that's really important. I know that there's, a component of the community really concerned about safety of vaccines, and these have not been shown to have serious adverse effects, but did have some mild side effects such as fever, muscle aches, headache, and fatigue. That goes along with a lot of vaccines, frankly. But these vaccines are moving forward into further testing with more patients, and that will hopefully get them approved by the FDA and be able to get them to the population.
Right. There's at least 2 that are doing phase 3. A lot of off-site testing or vaccines being given to patients, so not in this country necessarily. Although I just read something with the president of the AMA and also Dr. Fauci, where they talked about there is going to be a study here, and there are going to be several thousand Americans that are enrolled in the study. But in the ones that I know, there's at least 2 or 3 different trials going on in Brazil, where there's 15 and 15,000 in each of those trials that are just there. So most of these trials are trying to, for phase 3, ramp up into the 30,000 range of vaccines, and they're also, because of the perceived need and the early phase 1 and phase 2 studies, they're also ramped up their production. So they really expect, several million doses to be available. And some are projecting that it's going to be, like October-ish, but most of them, and most what everybody feels, is that there's going to be enough dosing for people by the start of 2021. And the other interesting thing, Heather and Donna, if you can discuss, is, when in this article that I read, it was just in JAMA, which is the Journal of the American Medical Association, Dr. Fauci and the president of the AMA were talking about immunity passports, which I was thinking about too, like how do you, how can you get around and how can we restart the world without knowing, status or whatever. And it's something that's good and bad, I think, because in a way it's another mark of, and it's a distinction and it's a separation, but at the same time, it's a peace of mind and it's a way of moving a lot of things forward. What do you guys think?
Well, school nurses already in the world of K through 12 schools or pre-K through 12 schools have students tracking their immunizations because there are school required vaccines that children need to be in school. And so in some way, that record from pre-K to 12 and even in childcare age is somewhat of an immunity passport related to the community of schools and childcare.
I think, as somebody who's had 4 children go through the system in public schools, and my 4th is still going through, the school nurses are tough, and you can't get past that door without your proof of immunizations. And they keep us up to date, not only our pediatricians, but our school nurses, letting us know what our kids need at what age. I just want to take a quick detour to ask you, if you're watching and you like this and you know anyone who's a parent or a teacher or cares about kids or just wants to listen to really smart ladies talk about stuff, please like and share and tag your friends and encourage them to watch in real time or later on our YouTube or Facebook channels. So if we go forward, Donna, school nurses do a whole bunch more than just check to see if our immunization records are up to date, right? I think you get really involved in the emotional and psychological health of children and their families. And I was going through the National Association of School Nurses website, and you have some incredible guidance there about how to continue to pay attention to behavioral health and emotional health of children, even with remote learning. And I'm wondering if you can talk to that and educate us about things that we can do to help our children stay healthy in our community.
Yes, certainly school nurses are able to determine what students are dealing with, because school and student mental health needs or emotions or social emotional status sometimes gets managed by physical complaints. So that student who is a little bit nervous about
wait,
COVID.
Donna, just a second. Somehow, oh, there you are. You came back. You were just snow for a while, and I thought it was
No, you know what? Donna,
And
if you're on your phone and you get a pop-up, that'll pop you off the camera.
okay.
Okay.
So, please go ahead.
Thank you. Thank you. So students and managing social emotional situations and fears and anxieties often present with physical complaints. So school nurses may sometimes see that student who is talking about a headache or a stomach ache, and they don't know what it is, and that school nurse in assessing and speaking with and listening to that student may sometimes determine that what's going on has more of an issue with anxiety or depression or fear, and they're able to refer to school located mental health professionals who can help students with that. So it's so important that school nurses are part of the school community, because they get to know students and get to be that trusted adult where students can share what's going on with them.
And I just want to read this comment from Laura Silverman, which I think is really spot on, that poverty and systemic racism has such far-reaching, long-lasting impact on children's health, and that epigenetic trauma will permanently affect their lives. And I think I couldn't agree more that it is so important that, this is another reason that everyone who's involved in public education, but as well private education, is that we want kids to go back to school for a variety of different reasons. And we've also found, there's a few articles out there talking about how remote learning has been not so good, for the kids. that they all talk about, and I'm sure you've heard about this, Donna. I never felt like I slid during the summer, but apparently there's something called the summer slide.
Yes.
Lose whatever you gained, and then you have to catch up again. So it is a concern, and now we have the COVID slide. I guess we're coining it here. It's the COVID slide, unfortunately.
Right. There is a COVID slide, and what we want is for a safer return to school. We want children to get all that they need because education is their work. That's what they do to grow and to develop. And being able to do that in a healthy situation is important.
I wonder, Heather, there are a couple of questions. There's one question that came up that said, can kids with asthma get worse wearing masks? And I'm going to just answer that question and say no. But I wonder, Heather, if you can talk about herd immunity and what does that mean? Do you think it's something that we should look for during COVID? Can you talk about Sweden's experience? That's just the phrase herd immunity, and I think you could go on forever, but maybe very quickly alert our viewers to what that means and what we should look for.
Sure. So herd immunity is the concept where if you have enough people exposed to a disease that build up antibodies that then pervasively in the community, the disease basically goes away. And I think the concern that I have about the idea of herd immunity developing to COVID-19 are the studies that show that the antibodies produced when someone has the infection last only for 2 to 3 to 4 months. And so to have sustainable herd immunity before a vaccine is available is not likely, given the fact that those who are exposed don't maintain the antibodies that neutralize the virus very long, meaning that they may be susceptible to getting it again. And so really it's the vaccinations that we were talking about earlier, and those couple companies that are in phase 3 trials that we're really pinning our hopes on to be able to have true herd immunity and antibody responses in a large portion of the population.
So, we mentioned briefly Sweden. Sweden's been actually, lambasted for their approach. However, there's also some commentary out there that perhaps their approach, may, while they felt some increased deaths, and Anders Tegnell has certainly talked about it, and he's the person who sort of has been guiding the Swedish government on this as an immunologist and epidemiologist there, and his approach. So you guys know, in Sweden, if you were under 16 years of age, you went to school. They kept businesses open at 50%, and they kept their at-risk at home. But they did, despite doing all that, see a little bit of an uptick in their death in their elderly population. So there's a lot of criticism for that. They also saw some diminution in their economy as well. But it's a question of how we're going to reopen, and the feeling was that the rest of the world maybe doing the shutdown was more extreme. And there's proponents for saying that what we did is right. Certainly, if we look at New York right now, where we've had such a reduction in COVID-19 infections as well as deaths compared to where we were in March and April, it's been astounding. And I think a lot of that had to do with the measures that we took in place, especially the quarantine, the mask wearing, and the social distancing are all important. And I went out to meet a friend outside today and went into a store to get a tea, and everyone just immediately assumed a 6 foot apart stance. You know what I mean? Like there was no crowding. So it's been a real learning, and I can see that people are doing it here in New York. And as always, I've always said I've never been prouder to be a New Yorker, but I think that, certainly the rest of the country could take a page out of what we're doing. And maybe, the way to reopen is to do some measure that's similar to what Sweden has done. And certainly that's what we're looking at in the fall, trying to get our kids back into school.
So I think there's a comment that Madagascar has no deaths. So maybe, Marina, that's where we should do our show from. Just fly out to Madagascar.
Together instead of.
Woo! I think we had put up a slide earlier when Donna was talking about the important role of school nurses, and I think we cannot de-emphasize that, because I think you really do act as the people who help families know what needs to be done, help teachers know. And I think you're 100% right. That kid who always comes in with a headache at period 3, something's going on there. And I think I direct our viewers to the National Association of School Nurses website for some really interesting information that will help you make your decision. I also, Marina had mentioned earlier that trying to figure out the risk reward of sending your child to school. And one of our viewers, Jason Campbell, asked, do you think schools are going to be able to give us options of opting in or opting out of school? And the CDC has some really nice, a checklist, really 3 pages of checklist of how comfortable you are with what your school is doing to keep you safe. So I wonder if you can talk to some of that, Donna, what the schools should be doing in order to open safely and stay open safely.
So schools really have to know what's going on in their community. They've got to know what the burden of COVID disease is. How is it spreading? And so that conversation to plan and to prepare for a safer return to school must be led by public health, accurate public health data, and must include school nurses who will have in mind the health implications and how to prepare, and a connection with the local health department. We have the guidance from CDC, as you mentioned. We have state level guidance. And what it comes down to is, in that community, what does it look like? What is the spread like? And so having those conversations that bring up scenarios, we heard a little bit in the first half hour about what to do if a child is exposed or has symptoms, what to do with an adult. All of those scenarios and questions need to be considered and planned for if schools are to reopen.
So I completely agree with you. I think there are a couple of other interesting questions that came up. Vimala Rajgopal, who has been a teacher in the public school system for, I'm going to say, a long time, because she's my auntie, so she's a little older than I am, talks about in-person teaching, especially with young children, especially with children with special needs, involves being very close to them, or group projects where children work together. And I wonder, Heather, if you can talk about the relative risk of that important thing that we're sending our children to school for in this era.
Sure. So I very much agree that one-on-one support is important. I think, what's been shown is that it's children who are less than 1 year old and who have underlying certain medical conditions such as asthma and heart issues who are at higher risk. I think that with masking and potentially even face shields, I think that teachers of special needs children who may or may not be able to maintain masking 100% of the time would be the safest way to do that. I think that instruction is critical, and that time spent is so important for those children's development, that we need to find a way to make it work and make it work safely. And whether that is taking history from that child's parents or temperatures and things like that, and then having them wear a mask as much as possible, but if not possible, have the teachers sort of be cognizant of contact with secretions and things like that, but also extra sort of cleaning protocols to be able to work with children who have various levels of special needs.
And I think you're right. I don't think if you have asthma, wearing a mask is going to hurt you. Children who are not particularly special needs are often visual learners as opposed to auditory learners. I take care of people with hearing impairment all the time, so I'll tell you, I use this mask like this, and the patient can see my face, and I am able to communicate with people with significant hearing loss. And I'm wondering if this is something, maybe Donna, you can talk about it, to help teachers, to help faculty and staff interact with children who maybe are more visual learners or have other types of learning needs.
It's absolutely essential to provide what's needed to maximize the engagement with students. And you're pointing out some of the things that have to be considered, like students who may have hearing impairment or may operate in a deaf situation, and how can we have the essential uh, uh, facial coverings, but also the personal protective equipment that would be needed for staff taking care of students with particular tasks that have to be done. Absolutely, we need to consider what would maximize that engagement.
I love how you threw in your new mask, Sujana.
Like it. It's
So awesome. You get it in red, it'll be really great. Yes, it's fantastic.
I think the cheetah print really does it for me.
Yes, yes. So these are great discussions. Someone just asked a question about preschoolers, and in New York State, the recommendation was if the kid was under 2, you did not need to put a mask on. And I think preschoolers, it's really the question of whether they can keep their masks on. I've seen plenty of kids walking the streets though with their parents, and they're wearing masks, and they look to be between 2 and 4. So it's going to be one of those things that we have to see if they can wear it. It's more an attention thing, right? Or if they forget about it, if they're playing and they forget about it, they'll put it on. But I think that it's probably something that the schools will have to determine what their policies are.
Mm-hmm.
We touched a bit on racial disparities in COVID as relates to the MIS-C issue, but racial disparities exist in COVID. Racial disparities exist in education and in healthcare. And I wonder, maybe Donna, you can talk to the disadvantages that may occur if we don't open the schools and if we don't offer in-person learning to certain groups. I mean, as you said, public schools take care of everyone. They took care of me. So I wonder if you can talk about that.
Well, I think every school community, every district knows their population, and serving that population, whether it's in-person education or whether it's virtual. We had an example during the school closures from mid-March and through the end of the school year this year because of COVID. And I believe that schools can look at those data that find out, were there any students who were missing? Were they not able to connect via internet because they didn't have services? Or were the situations in the family strained because parents may have been essential workers and students couldn't do the learning virtually like they wanted to? And then where did it work? We know that food insecurity is an issue with some families, and schools did a great job at trying to use different ways and to bring food to their families. So I believe schools have to really consider what happened in the spring through the end of school year, and where do we have gaps and where do we need help. I guarantee there will be places where there are gaps, and that needs to be considered in planning for a safer return to school, in person or virtual.
And in many, we're seeing this in the New York area that some parents are kind of banding together and creating like their own, summer camp for certain kids, and they're also, a group of kids so that the kids are kind of together all the time and not seeing a lot of other kids. And they're also thinking about paying for private tutors or homeschooling, which, obviously speaks to the disparity of what is going on in the economy, and just it's not something that everyone can afford to do. And I am a product of the public school system, just as Sujana is. So, I do feel the public schools did a great job, and I think around the country they do a great job of trying to engage the kids and teach them, and also provide all those other services, food, security, and that measure of safety, and also when they're having issues, identifying those issues. So it's a great shout out. Donna, can you give us your last 3 top thoughts on, or any points that you'd like to make before we close out? Because it's to the end of our hour.
Yes, that was quick. Accurate and reliable local public health data, including the community spread of COVID is very important to know. And so we want to make sure that is considered. And wearing face coverings, washing hands frequently, and adequate physical distancing does work. Whether in person or virtual, we know that there are students who have new or increased social, emotional, and mental health challenges due to uncertainty, to grief, to fear brought on by COVID, and that will need to be addressed. So school nurses and mental health and behavioral providers and schools need to be at the table. And we believe at the National Association of School Nurses that significant federal funding is needed to hire and retain school nurses for public school districts that will prioritize student health and safety. And finally, as the eyes and ears of public health and school communities, we know that the convergence of COVID and the upcoming flu season is ahead of us. And so collaborating with local health departments, school nurses can work to make sure that schools plan, prepare, and coordinate health and safety for schools and for students.
Thank you, Donna. Donna Mazyck is the executive director of the National Association of School Nurses, and beautiful closing words. Before I ask Heather for hers, I'm going to ask you guys, if you take your cell phone and kind of do a selfie with us, and if you put it up on social media, we'd really appreciate it. Do a little selfie. These three guests we've had on have been amazing, and we'd love it if their message could be spread, because this is a message of science and rationality and compassion. So having said that, Heather Klaus, could you give us your 3 takeaways that you hope people take from this?
Sure. I mean, I think the most important point about school reopening for me is that schools are a microcosm of their communities, and there's no one size fits all answer. And really, the answers to all these questions are incredibly challenging for everyone, both within and outside the medical community. And it has to be science-based, but it has to be locally based, and leaders and communities in different areas, depending on their burden of COVID disease and community spread and percent positivity. I think those are the key factors that communities have to look at when it comes to reopening the schools. And the next point is about vaccines. I think that it's critical that vaccines produce as much immunity as possible, but even if the vaccines were to attenuate the severity of the disease to some extent, that would be a huge win. I think that having a disease is one thing, but dying from a disease is another. And if we could prevent the severe morbidity and mortality, that would be a win for a vaccine. And so just to kind of moderate expectations for what a vaccine can and can't do, I think there's a lot of ways in which a vaccine can be a win for us, both for adult health and for reopening schools. And I guess the last point I would make is about the disparities. And I think that COVID-19 exposed weaknesses in really every facet of our society and of our community and of our hospitals and of our schools. And it really exposed, racial disparities in a way that I think was surprising to some people, maybe less surprising to others. And I think as humans and as healthcare providers, we have to really lead the charge here and focus on why those disparities exist and really center Black and Brown voices as we look forward to addressing these issues.
Exactly.
Thank you so much. This, I have to tell you, this has been the most wonderful hour. My daughter chimed in. She's in Delaware with her cousins, and she said, would you send your child to school? And where we live, the numbers are low. The community is cooperating, masks and gloves. So I think,
She doesn't want to go to school.
And she go to school.
She doesn't want to go. That's why she asked. School starting with me. That's what I'm hearing. Anyway, I want to thank you guys so much for joining us. We also would love to thank our production team. So there's a lot of credit to creating this show, and our other executive producer, and as well as our other producers that have put the show together. And want to thank you both again for joining us, Donna Mazyck and Dr. Heather Klaus, who's the Dean of Faculty and an infectious disease specialist. Donna is the current executive director of the National Association of Nurses. And then from the first half hour of our show, Dr. Goza is the a current president of the American Academy of Pediatrics. So thank you all so much for coming.
Thank you guys
Thank you.
so much.
Welcome. Thank you.
So Marina, this was a lot to process. I think you guys are wonderful. Our guests really gave us so much information. We will try to decant some of this over the course of the next week before we see you guys again next Sunday. So Marina, maybe you can talk to us about our guests next Sunday.
So we're going to still keep the same format. Maybe we'll do more news in the beginning, but we're also being joined by two great experts. So Dr. Claudette Lajam is joining us, and she's a orthopedic specialist in joint specialist, so both knee and hip. And also Dr. Benjamin Chang is joining us. He's a plastic surgeon and a hand surgeon. Why, you ask? Why orthopedics? Tell me you guys did not get hurt with all the Zoom and all the office work that you're doing on your computer constantly, or then thinking that you can just go out and run a couple of miles because you needed the exercise. So we're going to talk to them about injuries that you may have sustained. So definitely tune in, but pre-ask the questions if you'd like, and you can do that on our site at She's on Call, either through Facebook or Twitter. You can reach out to us and leave those questions for us, because these are two excellent guests.
Thank you so much for tuning in today. Please like and share and tag your friends. They can watch the entire show in retrospect on YouTube and Facebook. Thanks so much, Marina. It's always fun to talk to you.
It's always fun to be with you too. Bye, you guys.